But first tonight, we're using National Hispanic Heritage Month to shed light on some of the health disparities Latinx populations have to deal with. I spoke with Dr. Domingo Perez, a medical oncologist and breast cancer specialist at the Alina Health Cancer Institute, about how he thinks we can shrink some of those gaps. Okay, let's get into it. So why is breast cancer a particular problem for Hispanic women?
Well, let me start by telling you that breast cancer in this country is a big problem. About 250,000 women every year are diagnosed with breast cancer, and about 40,000 of those women will die of breast cancer. Hispanics are the largest and fastest growing minority in the country. And breast cancer, even though is less common in Hispanic women compared to non-Hispanic white women, is associated with a higher mortality in this community.
Can you talk about the disparities that need to be addressed, especially for Hispanic women, and especially when it comes to the disparities you just mentioned when it comes to breast cancer?
Well, as I said before, breast cancer is not more common in Hispanic women. It is more lethal. And it's not because breast cancer in Hispanics is more malignant. Stage for stage, it is equally bad. The problem is that Hispanic women are often diagnosed at a later stage when cancer is less curable. So why is that? Well, it has to do with two things, I think, One is ideas about breast cancer, such as breast cancer is incurable, so why bother? Or mammograms cause cancer, or if I feel a lump in my breast, it's better not to touch it or press on it because I want to make things worse. So that has to do with education and preconceived ideas about breast cancer. The second problem is access to screening, right? As we know, women in the Hispanic community often will not have medical insurance or will not be documented, so they try to stay invisible, and that delays tremendously the diagnosis of breast cancer. As I said before, if you can diagnose a breast cancer when it is stage 1, when it's a small tumor that is not in the lymph nodes, it is very curable. If you wait, it is less curable. So we need to get those women out of the house. They need to know that breast cancer, for the most part, is curable, and they need to go and get a mammogram. So if they don't have health insurance, we have to bring the mammogram machines to them.
What do you think should be done to improve the breast cancer burden on Hispanic American women?
We need to control weight through diet and exercise, refrain from alcohol, which increases breast cancer, and promote breastfeeding. They were doing it before they came to this country. They should keep on doing it now because it is preventative. So that's one thing. The other thing is, again, access to mammography and other screening tests, such as breast MRI, which we use sometimes.
I understand there are some new treatments too that are really improving outcomes. So if you want to walk us through what those are and what those look like right now.
So traditionally, we've treated patients with a combination of surgery, radiation therapy when it's needed, and chemotherapy and anti-estrogen therapy if the cancer is driven by the female hormone, by estrogen. But now we have other things. We have targeted agents that many times will come in pill form and target a weakness in the tumor. We have immunotherapies. We use them routinely to treat patients with the so-called triple negative breast cancer, which is a type of breast cancer that is particularly aggressive. So what we do is we stimulate the immune system so the patient's immune system attacks the tumor. And now we're using what we call antibody drug conjugates. So what we do is we take an antibody, a gamma globulin, which is what you make when you get a vaccine, and we attach chemotherapy to that antibody, and that allows us to deliver a very high amount of chemotherapy in a very selective way to the tumor.
And finally, we want to ask you, and I think I can anticipate your answer, but what would you say to women of any race who keep putting off those screenings, maybe putting off that mammogram?
I would tell them that most breast cancers, if diagnosed early, are curable, and that treatments for breast cancer nowadays are not what they used to be. They're a lot easier. Chemotherapy is not going to keep you vomiting for months. That happened years ago. I mean, I still remember when we had to put patients to sleep, literally, so that they wouldn't vomit. That doesn't happen. When a patient in the clinic tells me I vomited, I'm always surprised. If they tell me that they had nausea, you know, that's okay. But vomiting nowadays with the medication we have is very unlikely. And surgeries are not as mutilating as they used to be. My grandmother had breast cancer, had a tremendous surgery. We don't do what we used to be. So don't be afraid of it. If you feel anything abnormal, go to the doctor, keep up with your mammograms. If we catch it early, we should be able to cure it. And even if we don't catch it early, we should be able to help you and keep you living for, a long time. So don't delay.
We will be right back.